This is your Houston chiropractor, Dr. Gregory Johnson, and today we've got Matthew back in here that we're going to be treating for his spinal condition, which is causing his hiatal hernia. And I want to point out a few things today. If you notice, I've got him shirtless right here because I'm going to be using a technique that allows me to get very deep into the paraspinal musculature. See, I warmed the lotion up on my hands. This is hypoallergenic type lotion. And get his paraspinal muscles with that. And then I want you to look closely on the spine. You can see his whole right side of his spine, from his mid-thoracic spine to his lower thoracic spine, is elevated over the left side. So he has a curvature or scoliosis right through here, which has caused his rib cage to misalign. The rib cage is what is responsible for holding the diaphragm in place, and when the diaphragm is weak from misalignment, the stomach slips up into the esophagus. It secretes acid into the esophagus, and that's what hiatal hernia is. A lot of people start off feeling heartburn with that. Now I'm getting very deep, and you'll probably be able to see and feel right there's a knot. And you want to do this very slowly, and you start off light and then you just get deeper, and as you get to these nodules or trigger points, you just stay on them for a minute and they'll start to kind of melt under your elbow. This is one of those treatments that feels so good, hurts so good, I mean. Yeah, boy, you got a few knots through there, huh, Matt? Mm-hmm. Yeah, right here, especially up in his cervical thoracic region as well. Now I'm going to go ahead and switch on over to the right side. Yep. And boy, you can really feel those paraspinal muscles over here. Much more hypertonic or tighter. You can see that knot right there. I can't even stay on it with my elbow right there. So I'm going to get to that point. I'm going to stay on that point for a minute while he's breathing deeply. Yeah. Yeah, that's a big one right there. Now the nerves that come out of this area of the spine supply the sympathetic nervous system. Sympathetic nervous system causes what is known as fight or flight symptoms, which is anxiety and anxiousness. It causes a constriction in the vasomotor response, which is your circulation, so it cuts down the capillary size and doesn't allow the blood to flow freely. So you want to get this entire thoracic spine area under control and symmetrical from side to side and front to back. And right now I'm working on the paraspinal muscle, specifically in his lower thoracic spine, but we're also coming all the way up to his upper thoracic spine, which he has trigger points all through these muscles. Very good. And just like every patient, we start off checking the leg length, and it's short on the right side by about 1/2 inch, and when I bring it up, it gets even. You feel that tightening up there, Matt?
Yeah, yep. I do.
So when that's called a positive Knockless and Deerfield test. We know that his right sacroiliac joint is subluxated or misaligned. So we are adjusting that first with the internal rotation, because this is the base of the spine. Same thing on the left side. Now you notice I'm adjusting his right one differently because it has a different rotation in his sacroiliac joint. Sacrum being in the middle bone, ilium being the bones on each side, so therefore sacroiliac joint. Now I'm adjusting his sacrum, the middle triangular shaped bone, from superior to inferior, so that it pushes it away from the L5 disc, which is right down here at the very base of your spine. It's the most weight-bearing disc in your body. It's the one that tends to herniate the most. And it's also the one that, there we go. There, nice and easy. There, good job. Now you can see actually as I'm doing this, I'm actually getting torque, so you can actually see that on his skin now. It's a little bit slick because I put that lotion on there, but there we go. See, I'm getting way down into his lower thoracic spine, and we're getting really good movement all through here, which is exactly what we want to do. And you notice the little areas of red a little bit now. That's just from the blood vessels getting more blood supply in the region because I've stimulated that. Now we're going to come down and recheck his leg length. Excellent. I bet you this one feels easier.
Oh yeah.
Yep.
November.
Very good. Now I'm going to use his shirt to get a better grip on his upper thoracics right here. Excellent. Yes, sir. Very good. Now we just moved T1 and T2, which are the first two vertebrae in the thoracic spine. Did that with a thumb move. And see, we still feel these big old knots right here at the rhomboid muscles, which are between the shoulder blades and the spine. Those are tender too, aren't they, Matt?
Yeah.
There we go. Okay. Okay, my friend, let's turn you on your back now. And next thing I want to do is I'm going to do just a diversified palmar adjustment on his cervical spine. Drop this right in my hands for me. There we go. Same over here. Drop it in my hands. I got you. Tilt right a little. There we go. Okay. There. Now I've already decompressed him today, so I'm not going to do that again, but let's put your hands right there so they can see. Now, on this one, Ren, if you can get a little closer, I get right at the very base of his sternum, and you can see the difference in the height of his rib cage. You see that, how this left side is higher than his right side. And that's where you saw the curve in his bow and his back. It was right at this level. So I'm going to take a deep breath in now, Matt. Now watch as I get below the xiphoid process. I get right on top of the stomach, which is called the fundus. There it was. Did you feel that move, Matt? Yep. Good. And another one. And I'm going deep, deep down in there. And I'm pulling it superior to inferior on the y-axis as well. And again, and I think you can see the force, hopefully, that I'm putting into this and pulling that down. Excellent. Very good. Okay, so what I'm going to do is I'm going to finish his adjustment by, there we go, good. Adjusting his knees and his hips with this. Excellent. Should have felt that in your knee and your low back, didn't you? Good. Okay, let's have you sit up here now, face towards Renee sideways, like that, good. And we're going to adjust his shoulders, elbows, and wrists next. While I'm doing this, I wanted to let you know about a new website for consumers that is www.chiro, CHIRO, trust.org. And a lot of you viewers, and we have a lot of subscribers and viewers all over the world, call us or email us every day wanting to know if there's a chiropractor in your area that does what I do. There is one organization that has that type of membership, and it's called ChiroTrust. There's a lot of news on it lately, and if you check out that website, www.chiro-trust.org, you will find a ton of great articles on it about chiropractic care that are for the consumer. They're not an individual website. They're a informational organization that only has membership of chiropractors like myself that are doing mainstream chiropractic care without putting you on these big long treatment programs and not using a whole bunch of physical therapy modalities. Here you go, give your shirt back.
All right.
And I would encourage you to go ahead and call whatever chiropractor you're thinking about seeing and asking them if they are a member of ChiroTrust, because those are the most mainstream chiropractors in the country. Now we're going to do a adjustment on his atlas, which is a neuromuscular re-education technique. We're going to retrain his cerebellum, how to hold him in place. Let's flex your head forward and then backwards. Now he went down to the left on that one, straight back and to the right, now back to neutral. Okay, now on the side you can see his head's come up and way back from the first visit he was here. By the way, this is the third time we've done a video on him, so you can see the progress already. We'll go straight back. Now he's actually learning to do and has been participating in his home therapeutic exercises. And the patients who participate like that always see the best results. Okay, you can relax. And you notice I had him bend into that curvature, scoliosis too. So let's flex your head forward and backwards again. How'd that feel compared to the last ones?
Felt really
smooth,
flexible.
Yeah, smoother.
Yeah.
No clicking and grinding that time. No. Good. Okay. Well, I want to encourage you again to check out chirotrust.org for great information and scientific research on chiropractic. And this is your Houston chiropractor. We'll see you next time.